Hello, and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader of our Medical and Laboratory business here at Intertek. And today I am so thrilled to be joined by our guest, Wayne Stewart, from one of our Connected World teams. Wayne, thank you so much for joining me today. Really happy to have you here.
Yeah, well, thanks for having me. I'm very excited to be here.
Awesome. Well, Connected World is a really interesting area of our business. So maybe you could just start by giving a brief introduction to yourself, what you do for the company, and then we'll get into some of the exciting questions that we have about all things cybersecurity.
Yeah, absolutely. So my name is Wayne Stewart. I'm a computer engineer by trade, and I've been involved in cybersecurity at EWA-Canada, part of Intertek's Connected World, for just about 20 years now. In my time here, I've had an opportunity to get involved in just about every aspect of our business, which is entirely focused on cybersecurity. And now I oversee the business, including our medical device cybersecurity testing and services.
Yeah, we're super lucky to have you. And of course, when EWA joined Intertek, we were really excited, right, to be able to offer these services. Of course, we see cybersecurity as such an important element of evaluations and product evaluations, and coming up more and more. And having someone like you who's been in the industry 20 years, you've kind of seen it all, right? This whole evolution of cyber, starting from, really early stages to where we are now with these, huge advancements in technology and what we're seeing in products. So very excited to dive into some of these topics today. Specifically looking at medical, of course, we've had several podcasts where we've talked about cybersecurity for medical devices, always a really popular topic because it is such a changing landscape, right? We see this medical cyber requirements really rapidly evolving, and the requirements are changing and being updated on a regular basis. We see things coming out from the FDA and the different regulatory agencies. So maybe you can talk a little bit about, working in the business, being an expert. Are we seeing more medical device manufacturers coming in, completing cybersecurity evaluations because of these regulatory requirements that we're starting to see more of?
Yeah, definitely. I think there's a pretty big shift in the industry that's happening right now. A few years ago, cybersecurity was more of an afterthought than an active consideration, and really we were seeing evaluations, manufacturers asking for cybersecurity evaluations because they've had pushback from the FDA. Now it's different. There are stronger regulations, and there's a lot greater awareness that cybersecurity risks are real, are present, and manufacturers are taking a different approach. I'd say that medical device makers today are considering cybersecurity from the start a lot more often. So they understand, or are trying to understand, the risks of a connected medical device, a connected product, and they're being proactive to address those risks. So, we're seeing evaluations start a lot earlier in the process, and that those evaluations now are continuing throughout the product's life cycle. So, we're often being engaged as early as the design stage to talk about what needs to be in the product, all the way through the testing and even annual testing of a product to make sure that there aren't new risks that have emerged that might affect the device, the hospital, the patients.
Yeah, and I think that's such a positive thing to see, right, in the industry, this idea of starting earlier, right? It is very difficult to go in at the back end and try to address these requirements or try to put in some measures on the back end. But for some medical manufacturers that we talk to or see, I think it can be a little bit daunting, right, as we think about this idea of doing a cybersecurity evaluation or considering all of your cybersecurity risks. So if someone is new to this process, they have a connected device or they're developing a connected device, like, where does someone get started, right, if they're wanting to make sure that they're following the right path, considering these cybersecurity challenges and cybersecurity risks?
Yeah, it can seem like a big challenge, a tall order to try to look at these cybersecurity risks and address them for the first time. But organizations can really start with the basics. And there are very well-established standards like ISO 27001 and the NIST cybersecurity framework, where they can look at to start building the foundation within their organization to have the right sort of cybersecurity systems and culture in place. But specific to medical devices, I always like to look at the MDCG, which was published in 2019. There was a guidance for cybersecurity in medical devices. But ultimately, I think the key message out of it is secure by design is the mindset that is needed. You have to understand the threats that exist today and the risk that those threats pose to your device and to your patients. And make sure that the right controls and the right mitigations are in place. So if you start with that as sort of the entry level mindset, then you start looking at some of the other standards, and one that I think is the industry go-to today is the IEC 81001-5-1, which is looking at the secure software development processes and the requirements for a secure software development process. And you can build your entire development and design and development process around those requirements to ensure that you've got the right planning, the right testing, the right patching, and the concept of continuous improvement baked into the product from the start. So those are probably the two main areas. And then, as you delve deeper, there's always more. And so then you start looking at, well, what functionality needs to be in the product? And that's where you can look at something like IEC 60601-4-5 that has a lot of definitions for security levels. And it maps appropriate security controls for appropriate security levels. So if you can define that level, you can figure out really what types of controls and mitigations need to be in your product. Because not every product is designed the same and has the same risks. So it's an important thing to consider is like the right level of security for a device. I know this is a lot of acronyms and standards, but I would say that these are the industry go-tos today for where to look for the right kind of guidance.
Yeah, really good place to start. And I think, as you talk about laying that foundation at the very beginning to make it a much easier process for yourselves as a manufacturer, the continuous improvements, right? Continuing to stay on top of things. And of course, with medical devices, we're very used to the risk-based approach, right? So not medical device is a very general term, right? Lots of things count as medical devices, but not everyone has the same risk profile, right? And so depending on the risk of the device, what the functionality of the device is, you'll have a clearer pathway. Yeah. Another thing that comes up a lot when we're speaking with our medical device manufacturers that I think is really interesting, especially post-pandemic, right? We've seen a lot of medical device manufacturers suffering from lack of resources or lack of knowledge or expertise in cyber specifically or within their own organizations. So we talk about laying this framework, but sometimes people feel like, well, we just don't even have, anyone to start with. Are there resources out there, things people can be doing if they don't feel, it's not that they don't want to be addressing these requirements, but maybe they just don't feel that they have the resources, expertise, people internally to kind of address?
Yeah, absolutely. I think, feeling stretched is pretty common. It's almost ubiquitous in every industry right now.
The new normal, right? Yeah. Yeah.
Sure. But it doesn't need to be a roadblock. And I think, knowing when to look for help and when to seek external guidance can be a big strength for for any organization. It can be a real sort of team approach, especially when dealing with things like evolving standards and changing regulations. It can be a real maze. Bringing in that outside help that outside person can be the expert in that domain and really act as a guide. So our experts, for example, live and breathe cybersecurity. Many of them have several decades of experience that they can bring to the table, and for better or worse, they've pretty much seen it all. So what we're not trying to do is replace a manufacturer's team, but work within that, understand where their strengths are, and then complement that with either consulting services or additional testing services. And one of the areas that I always strongly advocate for is having an independent vulnerability assessment and penetration testing of the device, as well as any associated IT systems that interface with that device. That type of independent testing often leads to findings that even the most experienced internal team can easily overlook, because sometimes you're just too close to the product to see problems or to try to use it in a way that it's not supposed to be used.
Yeah.
But ultimately, it's this type of collaboration with an external expert that can help manufacturers be a lot more agile and be more prepared for changing environments, right? Like I said, we live and breathe this. We've got a pretty good idea of some of the common issues that are found, as well as where things are going and what the trends are in cybersecurity. So we always aim to have to give that sort of helpful insight to that.
Yeah, and I think it's interesting too, right? So you mentioned this idea of the third-party validation, right, or the third-party testing for penetration testing or doing a vulnerability assessment, right? And we see regulatory agencies wanting to see that, asking for that more, right, with the FDA, and you see letters back when people are having non-conformances or things that they might be asked for. So is that something that we think is, becoming more industry standard to do these vulnerability assessments, penetration testings, and have that information readily available to be with a submission?
Yeah, I think at this point in time, pretty much everything needs a vulnerability assessment, penetration testing. That's what we're seeing. The question is really not if it needs it, it's what's the appropriate scope. And that's where we try to work with manufacturers and understand all of the interfaces, all of the components, all of the external, anything that deals with the outside world that connects into sort of the IT system, and make sure that we're addressing any of the security risks in that space.
So as you add multiple points of connection, applications, different parts of a medical system, it can get larger and larger in terms of what the scope is of what you would look at.
Absolutely. Yeah.
Yeah, makes a lot of sense. The other thing you pointed out too, I think, having these experts within our organization that have, been around so many different types of devices, you see a lot of medical evaluation. You mentioned kind of sticking points or common failures. Are there things that we see as a commonality across medical devices, across evaluations that we do in general? Just easy, I don't want to say easy things, right? That might be misleading, but just general things that maybe we see are common sticking points or common areas of concern. Is it documentation? Is it in the actual testing itself? Like, are there things that we see on a regular basis or on a repeated basis?
Yeah, from a testing standpoint, one of the things that we saw frequently was insecure designs, where the connectivity was added on as a bolt-on solution. Hey, we've got this medical device. Wouldn't it be great if it connected to the internet? Okay, probably, and a lot of times there's a lot of advantage to that. But if it was an afterthought, it also creates a lot of challenge. Now, the good news is we're seeing that a lot less frequently. So I mentioned earlier that secure by design, and I think that's really been embraced by the industry. And we've worked with a lot of manufacturers that had early generations of product that had these types of flaws, recognized it, and now we're seeing their new generation of products that address a lot of the concerns that we had early on. So those insecure designs have been a common problem, but are starting to we're starting to walk away from that as a common thing. Another issue that can be a challenge and is often not considered by manufacturers is the updating of the underlying components. I think at this point in time, everybody knows that IT systems and cybersecurity is ever changing, ever evolving, and patching is necessary. But sometimes it's the scope of that patching that is missed. If you are using a third-party operating system, third-party libraries, any kind of third-party software component, you need to have a plan in place to make sure that gets updated as well, because it's not just your code that might have a vulnerability, but it's all the code that's being incorporated into your product. And it's equally as important, if not more important, to make sure that those components are patched at the same time as any other vulnerabilities. And I think the other one that I would flag as a sticking point, or it's not so much a sticking point, but maybe a susurprise to some manufacturers, is that we're seeing that regulators are more and more requiring malformed input testing of pretty much any physical interface for a connected device. So malformed input testing, also known as fuzzing, is a type of testing where you're throwing maybe random, malformed, or really just unexpected inputs at a device, and trying to sort of understand how it responds to that unexpected input and see if there could be a security weakness associated with how it's responding to it. And there are a lot of common interfaces that we test regularly, whether it's the Ethernet interface or a USB interface or anything like that. But we're also seeing requests to do this fuzz testing on proprietary interfaces. So we need to develop custom protocols. We need to understand that interface, understand the communication protocol, and build up our custom cases, as well as even fuzzing of touch screens or mechanical dials on a medical device. What happens if you turn it when it's not expected to be turned, or more than it's expected to be turned, and does that create, I guess, an unknown state within the device? So yeah, I think those are some of the areas where either it's a sticking point or somewhat of a surprise that's pretty common in the types of assessments that we do today.
Yeah, really super interesting. And I think, as we continue to see this evolution of technology and just these really incredible medical type devices coming out, I think this idea, as you mentioned, right, of being really bespoke in the types of testing that you're doing, because every device is different, every device has different risks, right? And so you really have to understand the overall device, the overall system, how it works together to make sure that we're doing the right level of testing, because there's no one size fits all anymore. I think really in any element of the evaluations that we're doing for medical devices, but especially in this space, because you're just seeing, everyone making these really incredible advancements, which is amazing from a patient perspective, right? From someone who's receiving these technologies. But then on the manufacturer side, there is some additional work that then has to be done to make sure that you're considering all of the risks, right, that might be involved in the product. But that kind of brings me to another thing that I'm always really interested in when we talk about medical devices. We look at this from a product evaluation side, but what about the human error piece? Like, is there testing that we do that accounts for humans, right? You're talking, we have patients involved, you have healthcare providers involved, right? A lot of times you see human error in these cyber events or cyber incidents as they happen. So are there things that we do to help test for that? Are there things that a manufacturer can do to mitigate the human error piece? Like, it's just always something that's so interesting to me in the medical space, because you have so many people involved, touching, handling, participating in the process of use of a medical device.
Yeah, absolutely. In terms of the testing, I think that malformed input testing is a great test to sort of account for possible human error. You just never know how somebody's going to interact with a device or a piece of software, and they'll almost always interact with it in a way that you didn't expect. So that's where that fuzzing really kind of starts to look at that. And then the other part is that's one of the reasons why I, as I said earlier, I always advocate for independent vulnerability analysis and penetration testing. because when a team like ours comes in and tries to test the device for the first time, they're going to do things with that device that may not have been considered before, because maybe they just don't know any better, but you have to account for that. You have to plan for that. But on the manufacturer side, I think one of the things to realize is, human error is a fact of life. It's not going anywhere. We can't eliminate that. What we can do is try to mitigate it with simpler approaches to security. So when you're designing, we talk about security by design, but that should include the concept of secure by default, right? Plan for an insecure environment. What happens, if somebody connected a medical device, and I don't know why they would, but directly to the internet, no firewalls, no anything. Does it have the appropriate security to ensure that it's protected, even though it's directly connected, right? It's a sort of security in-depth concept, and it should be enabled out of the box. So oftentimes what we see is there's assumptions that, an administrator is going to come in and configure a device and do all the security settings and then make sure that it's on a network with the appropriate security controls. But from my perspective, let's assume that's not there. And let's take a reverse approach and say, if you want to weaken or disable security function in the product because it exists in the environment or another configuration, that should be an explicit, authenticated action by an administrator to disable it. And that way, I think we eliminate a lot of that type of human error, which is often just, I didn't know I was supposed to do that.
I love the tagline secure by default too, right? I mean, that's such a good way to look at it, right? Not overcomplicating things too much, but just making sure that it is secure by default. What's interesting too, that you brought up there that I think kind of leads me to another thought that I was having, especially after, you guys recently wrote that article for the web about our, cyber threats that we see in healthcare facilities, right? So not necessarily specific to what we see with the devices themselves, but the devices and as they're used in a healthcare facility, right? How a healthcare facility works with the network. Are there things that, you want to touch on or can highlight from that when we think about actual facilities and products operating on a network within a facility?
Yeah, absolutely. Healthcare facilities are such a prime target for cyber criminals. And the reality is the more devices that you connect into that environment, the more complex it is and the harder it is to secure. So that's why ensuring the medical devices are secure by default is so important. But we have to consider there's risks to the patient, there's risks to the hospital. For patients, these devices and these networks are handling their very personal medical information. Often it's like the most intimate details of their medical history might be available. And not to mention payment information or contact information, or any other type of personal information. And the fact is, on the dark web, the value of medical device, or sorry, not medical device, but medical patient history is far greater than the value of, say, credit card information, because your medical history doesn't change, and it can be used for a lot more than just credit card fraud. From the healthcare provider side, the risks, I think, is maybe even greater. Cyber attacks are a big problem. It can create, it can disrupt critical care for patients. It can delay essential medical services, and it can potentially put lives at risk if the IT system is down and the medical staff doesn't have access to their patient information that they rely on to deliver care. That's a big problem, and not to mention the financial impact.
Yeah.
So last year, a health breach of a healthcare center in Canada, the average cost to deal with that was, I think, $13 million Canadian per breach.
Wow.
So it's a significant cost, not just to the patient, not just to the medical care, but an actual financial cost as well. And so then we get into it. We talked about secure by design, secure by default, and now security in depth. Right? We got to make sure that every component is secure within the environment and almost independently of the other controls. We want to make sure that all of those security controls can stand on their own, but work together to secure information as it traverses the network.
Yeah, I think it's going to be super interesting to watch again, right? Just knowing that it's such a place that, their attacks happen, right, with these hospital infrastructures. And yeah, it's really important that as an industry, we're all working together to make sure that these products are secure, that these things are, prevented and mitigated by, as you say, right, at all levels to help make a difference. So really incredible. I mean, I could just talk to you about this topic forever. So evolving, so many interesting things that come up when we talk about medical devices and cybersecurity. Is there anything else that you want to leave us with? Any hot tips, tidbits, tricks, anything you want to share today that you don't think we covered?
Maybe just I'll say a little bit of hope in the sense that, we talk about the risks and it can be scary. And I'd say I'm encouraged right now to see the trends in the industry and the progress that we've seen in medical device cybersecurity from, when we first started working with medical devices to where we are now. There's definitely been a lot of progress. It's not perfect, but we're on the right path, and I'm really encouraged to see things continuing to improve.
Yeah, I love to end on a positive note. Definitely more clarity than there used to be, right? Things moving in the right direction. So Wayne, thank you so much for joining me today. Of course, if anyone has questions, you can always reach out to me directly and I can connect you with Wayne and the team if you want to have a deeper discussion on anything medical cybersecurity. Thanks so much. Have a great day.
Thanks so much.